Your face age in motion, not in mirror. Because facial muscles over time get smaller and skin becomes less elastic, that's why wrinkles, folds, and sagging appear more clearly during speaking, smiling, and frowning. That is what Botox is used for. Botox will disappear your wrinkles in several days because Botox freezes the muscle that creates them. Botox is botulinum toxin, which is injected into the face in small doses. It relaxes facial muscles for months, and the person looks younger and more youthful without wrinkles. Generally, botulinum toxin is deadliest toxin. Even 1 gram is enough to kill million people. But in medicine, it is used in very small controlled doses, and it has only local action. It does not paralyze whole body. This is different from improperly canned foods at home, which can kill a person by muscle paralysis of the whole body leading to stop breathing. Botox is approved already for more than 20 years by FDA. It's considered safe and effective. It is number 1 non-surgical cosmetic procedure worldwide with more than 7 million treatments per year. Botox is most effective for dynamic wrinkles. It means wrinkles caused by repeated facial movement like frowning, smiling, squinting. Botox is most effective between 30 to 55 years because wrinkles are mostly dynamic and not yet deep into the skin. In your 40s, Botox has almost 90% effectiveness. After 60s, Botox is less effective because wrinkles become static, stay even without moving the face. Skin is thinner, less elastic, with loss of collagen and elastin and sagging. Botox still help, but not as much. Botox injections are most effective for glabellar frown lines between eyebrows, crow's feet, around eyes, and forehead horizontal lines. These 3 areas account for 90% of Botox usage. Possible, but less common uses, bunny lines on the nose, chin dimpling, neck bends, and jawline slimming. Botox is not effective for static wrinkles, deep permanent lines, or sagging skin because they are due to loss of collagen and gravity, not muscle contractions. Botox does nothing for stretched skin. Botox is not effective for volume loss in cheek, temple, or lips. Botox is not a filler. In this case, hyaluronic acid fillers are used to restore volume. The age for Botox is considered 30s to 40s because dynamic wrinkles appear and Botox gives both treatment and prevention for deeper wrinkles. Botox is not only for present wrinkles, it prevents future ones because if you stop the muscle from folding skin thousands of times a year, the skin has less breakdown. Long-term users of Botox show fewer permanent lines compared to non-users of same age. On average, it delays wrinkle formation by 5 to 10 years. In some cases, Botox is recommended in 20s because some people have very expressive faces and strong frown muscles. Low-dose baby Botox is used here to reduce early wrinkle formation risk. Routine use in all young people is not recommended. After 50, Botox still helps, but less. It is usually combined with fillers and lasers. Botox procedure is injections of botulinum toxin type A, which blocks acetylcholine release from nerve to muscle and relaxes the facial muscle. No anesthesia needed. Topical numbing creams or ice is enough. Because the procedure is simple and fast, it is often called a lunchtime procedure. Botox spreads around 1 centimeter from the injection site If you inject the wrong place, it can paralyze unintended muscle. That's why sometimes we see droopy eyelids, ptosis, crooked or uneven smiles, or asymmetry. Exact knowledge is important, and even millimeters matters. An error can last around 4 months. When injected by an experienced professional, Botox satisfaction rate is more than 90%. Effect starts within 2 days, subtle softening, peak at 2 weeks, and effect lasts up to 6 months. Active muscles, activity returns within 4 months gradually. Repeated injections are recommended every 3 to 6 months. Sometimes longer intervals are possible because repeatedly train muscles to weaken. Repeated Botox can cause mild atrophy of injected muscles and can lead a flatter forehead or slightly hollow temples. Due to reduced muscle mass, usually it is subtle and not harmful. Most patients and doctors see it as an additional anti-aging effect. Botox does not accelerate aging. Muscle atrophy in the face due to Botox does not equal skin aging. Skin aging usually happens due to ultraviolet exposure, loss of collagen, hormonal shift, and fat redistribution. Botox is medically used beyond wrinkles. During excessive sweating, hyperhidrosis, it decreases sweating by 90%. During chronic migraines, its effectiveness around 50%, reduces monthly attacks more than 50% of patients. Bruxism, jaw clenching, effectiveness is around 70% of cases. And eye spasm, blepharospasm, it's effective around 80% of cases. Now let's say other guidelines supported anti-aging options. Topical retinoids, tretinoin, adapalene, and retinol for fine wrinkles, pigmentation, and photoaging has 30% effectiveness, 30% fewer fine wrinkles after 12 months. They stimulate collagen and normalize keratinocyte turnover. Spectrum sunscreen is highly recommended in almost all guidelines because photoaging causes 80% of visible aging. Hyaluronic acid fillers for static wrinkles and volume loss. Effect lasts around 1 year, best for mid-face sagging and deep folds. Fractional laser resurfacing for deeper wrinkles and texture scar, high effectiveness but higher cost also. And antioxidants like vitamin C, vitamin E, and niacinamide can be used as a supportive treatment.